Pickler. She's a fan of them. She sang a song about them. High heels, that is. And now one doc is saying the fancy footwear could actually be good for your health. So we sent Kristen Anderson out to learn more. Hi, Kristen.
I'm looking for some hard-hitted evidence here, you guys. This is the assignment of the morning because people always tell me, you know, I love high heels, and people always say, those are so bad for you. But it turns out, take a look. I'm rocking these ones today in honor of this story. They're really, really high, but they're actually really comfortable, too. The higher, the better. Okay, that's according to Dr. Michael Robb, and he is here at FIX24 Chiropractic. Right. I love this, so tell me about it. The higher the better, that's true.
That's true, because the higher the high heels tends to throw your back into extension, and we know it puts a better curve in the lumbar spine, which reduces back pain. So it's much different than the old research that used to say flats were better for your low back, and it's not necessarily that.
Okay, so we've got some really beautiful high heels. I was asking the ladies in your office, are these yours? Because these are nice. But does it differ with wedges? Because I know wedges, I mean, they're more comfortable for me.
That's right. In wedges, high heels, they're all the same. Mechanically, the higher it is, that causes the back to be placed into extension. Extension is where we get our great posture from.
Okay, very cool. So let's step back a little bit, and we'll have these two lovely ladies here do a mini catwalk for us. And tell me about it. So first, flat.
Okay, Whitney's got flats on right here. So if we look at the lower back here, it tends to flatten the lower lumbar spine out, okay, which is really causes some people to actually lean forward in flexion. This is what we don't want. Okay. Flexion is a sign of bad posture when you begin to lean forward.
Okay. And now secondly...
Secondly, we have very high heels on this patient. So when we turn sideways and look at the lumbar spine, it's forced to curve forward. This is much better for the posture because it throws the shoulders back, throws the rear end out, and increases those curves in the spine, which acts like a spring to absorb compression.
Okay, so now we see it with the ladies. Let's walk back and take a look at the x-rays so you guys can see more exactly what we're talking about, or what the doctor's talking about, rather. And I just want to clarify, though it is great for your spine, you're saying, not necessarily for the foot, because we have heard some things about feet. It's not the greatest, the high heels.
Right. And what we're seeing here is what we call a lateral view of the lumbar spine. This would be the front part. This is the back part. A very straight spine, not much of a curve in there. This is a typical patient who would wear flats all the time. Once we get into a position like this, we can see the curve is much more arched. This is due to putting high heel shoes on, which activates lumbar extensor muscles called the quadratus lumborum muscles, which is excellent for posture.
Doctor, thank you so much. I really appreciate your insight this morning and your time.
My pleasure.
All right, back to you. Break out those high heels, ladies.
I got a pair on, except I'm bad. I take them off as soon as we're done with the show.
Oh, yeah, you're big on the flip-flops.
Yeah.
The sandals, what do you call them?
I know, flip-flops.
They look cute. Well, you got a little shift on.
Well,
you wear whatever
they never look, it's like everything looks okay, and then you look down at my shoes.
Nah, they look fine.
Oh, well.
Are you a Harry Potter fan?
So, yeah.